Welcome to Skin Deep here on SiriuxXM channel 141, HUR Voices. I'm your host, Sharrarne Morton, and we're in the studio doing part 2 of last week's show on breast cancer and breast health. And as I said in part 1 of the show, all of us know someone who's been affected by this horrible disease. Here at Skin Deep, we want to do more than just talk about it. Let's be about it with some information that you can use to change the trajectory. Morton here with Dr. Taguchi on the phone. She's an oncologist and breast cancer specialist. We have Dr. Dyson in the studio as well from CFL Wellness. You can see her site on cflwellness.com. And we have Brenda Brown, author and activist in the studio as well. So, Dr. Dyson, you wanted to jump in on what Dr. Taguchi was saying.
So a continuation of this conversation. In your book, Sex, Lies, and Menopause, around the time that we go through menopause, which is the perimenopausal period, and right at the beginning of menopause, we're in a low estrogen state without the cycling of the progesterone as is normal for us when we're in our reproductive years. Can you discuss how that predisposes us to get breast cancer, just being in that state?
Because that's where I am right now, in that state.
Exactly.
Yeah.
That's where most women will be over 50.
Okay.
Correct. Well, I will tell you what I can surmise, given those stats that we have. So as women are heading into menopause, they're losing their estrogen and progesterone, the amount of hormones that are made over time. So the amount of estrogen you make at 45 is significantly less than if you were 25, even though you're having a regular period,
Right.
even though the period seems to be the same. But the hormone levels are very different because you're sliding into menopause.
Mm-hmm.
And so what ends up happening, if you don't have enough estrogen, you don't create an egg or pop the egg, and then that egg does not produce progesterone. And progesterone is kind of like I want to call it the cleanup guy, or it wipes the slate clean so you can start over every cycle. And it blocks the estrogen receptor. It's kind of like the off button for rough tissue.
Mm-hmm.
So you have the stimulation of estrogen, and then you have the blocker for the progesterone. This is just like for the breast model, and the uterus as well, for instance. So you need this on and off button, or it's a cycle. They do things. It's not one static, same thing all the time.
Okay.
So we turn on the growth of the cells and we turn them off. And when we go into this menopausal state, we no longer have the on and off button anymore.
That protects us.
Would you say that, Dr. Taguchi?
I think that was very well articulated.
What about women? This is Brenda. What about women who are in menopause and have been in for a while, maybe over 9 years? And what happens? What's going on there when it just continues and it's very severe? Dr. Dyson has crowned me the second worst case she's seen, and I am on the Wiley protocol. I don't know if you heard that earlier when I said so.
She just started back recently. This is her first month back, I think, or maybe second month back on it.
The Wiley protocol is the same as the HRT,
No,
that's different.
It's
Okay.
compounded bioidentical hormone replacement therapy given in a cyclic and rhythmic dosing pattern.
That's what Brenda's on.
That's what I'm.
Okay.
Yes.
All right. So your question to Dr. Taguchi
was what about us? I mean, my particular case seems to be, as Dr. Dyson said, the second worst case she's ever seen. Is there a reason why that happens to some women? Why it's so extreme in some women?
I don't have the reason why that happens, but it's like 15% of the women have like awful, terrible menopausal symptoms for the rest of their life, or all of their life.
I would be one of them as well.
a man in my life, please. Goodness.
Their own issues too.
So,
but women, on the other end, there's also women, 15, 20% of the women who kind of go, oh, I didn't have my period, and they're done.
I understand that. I have those women in my family. But I'm the sore thumb. I'm the person who's struggling through it and going through hell.
So that's
And
15 and 15. So that's 30. What about the other 70%, Dr.
It's,
Taguchi?
and it's kind of average, you know, it could be, you know, 6, 8 years of menopausal symptoms.
Okay. Oh, so that's, is that the
So
answer?
she wants to know basically what's been happening to
Right.
her over this 9-year period
Of time.
Basically, what is the level of deterioration, I guess, is what she's asking.
Yes.
And decline.
And won't the Wally protocol help her feel better, though? What you have her on?
Yeah, but let's answer
Okay.
question 1 and then we'll
Alright.
get to question number 2.
Okay. So when women slide into menopause, they're losing their reproductive estradiol from the ovary. But the body will convert and will maintain estrogen. They'll get their estrogen from their adrenal glands and from androgens. So the adrenal gland will make androgens, and those androgens will, you know, are supposed to turn into estrogens to help protect and, you know, have the body work off of that type of estrogen. So that's why a lot of women get chin hairs or they lose a hair on their head. You know, they're more masculine hormones than those do estrogen.
And listen, I'm not laughing at anybody. I'm laughing at myself because I just got a chin hair the other week and I nearly fell out on the floor. But okay, go ahead. All right, so go ahead.
So, and then, you know, we know that with women, estrogen is very protective to the heart.
Yeah.
And so men start having heart attacks around 50, and women who have menopause around 50 start to have heart attacks more so at 60. So there's a protective period in that time that as the estrogen's falling off, we start to become men and have similar problems at that time.
So that's the question okay, well, go ahead. Go ahead
No,
and finish.
go ahead.
That's the question I'm asking Dr. Taguchi and Dr. Dyson. Is this hormone, this bioidentical hormone replacement therapy going to protect women from breast cancer and a myriad of other things? If they haven't gotten breast cancer yet, is that going to protect them from getting it?
Okay, you should know that in the Women's Health Initiative, they absolutely proved that with using Premarin. That
Right,
is
of
urine.
course, right.
Okay.
But you said there were so many other issues that
They
came with
proved
that.
it when they used it alone, when they found a decrease in breast cancer of the people who were on Premarin.
Okay. And
So
what,
that,
go ahead.
no, the study was the women who did not have a uterus took Premarin alone. It was for 6 years, and then they stopped the study. They followed those women, and even at 10 years later, they reported those women had a reduction in breast cancer over 20%.
Right,
And
but
that
those were women who
reduction
had
held.
those were women who had hysterectomies, though.
Yes.
Okay,
That's
what
I'm
about
saying, they didn't have
women
uterus.
that have not had hysterectomies?
Those were the women that stopped on the Premarin arm and or whatever, and they were not followed.
Okay.
So
But I can tell you, the women
this-
who had more breast cancer on that arm, which is the Premarin, that's why the Women's Health Initiative was stopped. It's because they noted that there was more breast cancer in the continuous combined Premarin Prempro arm, and that what they found out as time has gone on. I will tell you, those cancers were already in those women, and that combination made those cancers grow and show up sooner
Okay.
than they would have naturally.
Okay.
There is no difference in death from breast cancers in either arm. Okay, that's important to know too. It didn't kill women more so because they had it.
Okay. All right.
I'm
What is she-
confused.
yeah, what is she saying?
What's she saying?
she's
Dr.
saying
Dyson?
that there was no difference in death in either arm in the women who were on Prempro, which was Premarin and synthetic progestin, versus
A placebo.
yeah.
Okay, and when you say arm, our audience, we're lay persons, so we may not understand. People may actually think you're talking about in the cancer in the arm. You're just talking about sets of women that were on placebo and on the replacement.
Or on replacement.
Yeah, or on replacement. You had another question, Dr. Dyson or Brenda? Because I had a question. Go ahead. What were you going to say? I had a question about birth control. So, I've heard that birth control, because of the, I think progesterone and estrogen, synthetic hormones that are in birth control, that contributes to breast cancer. Is that true? And if so, what do you propose to women who are on birth control? What other methods should they take into consideration?
So what I have developed, my advice over the years, is, particularly to young women, is like, I think you can have 5 years of birth control pills. Choose your best 5 years. It's going to be college, post-college, pick your best 5 years.
Wow.
And then at that point in time, I think it's an issue. We know that prolonged birth control pill will contribute to the risk of breast cancer, at least for sure over 10 years of use. But there's another problem.
What is that?
When women use birth control, they're knocking down estrogen levels. You're becoming menopausal. This is a controlled menopause. That's why you don't get pregnant. You're not flooded with hormones. You have low hormones.
Oh my God.
Oh my gosh.
So, I know, surprise, surprise. So women have young women with osteoporosis, young women with dental problems because their teeth are falling out.
And this is
bone health.
a result of them being on birth control for long periods of time.
Yes. And
Okay.
then, of course, one really important, a lot of women on birth control pills, they kind of forget to get pregnant and have children. And those are the reproductive things that happen to help protect against breast cancer.
Okay, Dr. Taguchi, we gotta take a quick break.